Urologic Health with Dr. Ricardo Gonzalez, urologist and FPMRS specialist.
What is vaginal prolapse, you ask? Vaginal prolapse is also referred to as a vaginal bulge and often referred to as a drop bladder. And what it functionally is, it's a hernia of organs that are typically in the pelvis that have dropped into the vagina. And so you can have a drop bladder, but you can also have the uterus dropped into the vagina. It could be small or large intestine, and depending what is in that bulge, it has a different name for that specific type of prolapse. So the bladder's dropped, we call it a cystocele. If the rectum is in the vagina, we call it a rectocele. If the small bowel has dropped into the vagina, we call it an intracele. And if everything is dropped or the uterus is out of the body, we call it procedentia. So what causes prolapse? There's several causes of prolapse, and they combine to affect a woman's risk of developing this herniation into the vagina. So it could be a family history. So if your mother had a drop bladder or had prolapse, a patient is more likely to have it. Or if a woman has had more than 3 vaginal deliveries, or perhaps 3 pregnancies and prolonged labor, it can also affect a woman's propensity to develop vaginal prolapse. Some women get it from heavy lifting. They might have 2 deliveries, but let's say they work as a postal worker or lifting heavy things. And if you're lifting heavy things all the time, you can develop this herniation into the vagina called prolapse. Some women who have had a surgery like a hysterectomy can develop prolapse from having the uterus removed. So when the uterus is removed, it creates a space where organs can slip into the vagina. In the case of small intestine, that would be an intracele. In the case of a bladder, as I mentioned earlier, it would be known as a cystocele. So how does prolapse affect your life? Well, some women have prolapse and have no bother. They might not even notice that they have a vaginal bulge until they go to their doctor, who tells them that their bladder is dropped. But some women can be bothered, and they can be bothered by having a bulge coming out of their vagina, or they feel pressure when they sit. When they stand a long time, they feel pressure in their vagina and in their lower back. So pain and pressure are some signs of prolapse that can be bothersome. It can also cause difficulty urinating. Typically, bad prolapse of the bladder makes it difficult for the bladder to empty, and women sometimes have to use their hands to push the bulge in to empty their bladder. Same thing with bowel movements. If a woman has a rectocele, stool can get trapped in that pocket and make it hard for a woman to have bowel movements. Sometimes if the rectocele is bad enough, women have to use their hands to push on the vaginal side to help have bowel movements. And in the case of that maneuver, that movement, we call it splinting. And that's one of the things that can get repaired with surgery, or some of the things we'll be talking about. So what are prolapse treatment options? How can we treat prolapse without surgery, some women ask. Well, if prolapse is early and we feel it's due to pelvic wall laxity or just weak vaginal muscle walls that are allowing sagging of the pelvic organs, then exercises can help there. Those are known as Kegels exercises and can be either taught with your physician or from watching a video, or you can go to pelvic floor muscle therapy, or PFMT, that can help you work with a coach that teaches you how to strengthen these muscles. So that's one option that's non-surgical. Another option is a pessary. A pessary is a silicone disc or device that can be inserted into the vagina. There's different shapes of these devices. And they lift up whatever is prolapsed. So they can lift up the bladder, lift up the uterus without surgery. Some women learn how to manage these on their own and can take them out and clean them periodically. Other women prefer to come into their doctor's office for us to take them out and change them periodically. So pessary is something that would require some maintenance but does not require surgery, and is a minimally risky way to treat prolapse. What are the surgical treatment options for prolapse, you ask? Well, there's 2 general approaches to surgical repair of prolapse. One is obliterative procedures, and the other one is restorative or reconstructive procedures. Obliterative procedures are for women who are not sexually active because those surgeries involve us lifting everything where it needs to go and closing the interior of the vagina so that the organs cannot slip back down into the vagina. So basically you fix the prolapse and you close the inside of the vagina so prolapse cannot come back. By making the vagina into a very narrow tube, prolapse is very unlikely to recur. The operation is relatively straightforward and quick as far as these operations go, and the recovery is relatively easy. For women who seek pelvic floor reconstruction, they are likely seeking an operation that will restore their anatomy, put the organs where they belong, and allow them to have improved or normal function of how they urinate, how they defecate, so how they have bowel movements, and how they have sex, so it can improve sexual function. These restorative or reconstructive operations are either done through the vagina or through the abdomen, and the purpose of that is to lift organs where they need to be, to repair any defects or openings where organs have slipped through, and sometimes to reinforce the weaknesses in the pelvic floor, either with a patient's own tissue, with a graft that can be taken from either donated tissue from a cadaver or from an animal source, or from mesh, which is a synthetic product that can support the pelvic floor. The risks and benefits of each of these procedures depends on how the surgery is done and what is used. So these are things you want to discuss with your doctor. And one of the benefits, I think, of approaching reconstructive surgery through a vaginal approach is that there's no visible incisions, and the recovery should be better because the abdominal cavity is not violated during that operation. Vaginal surgery also allows us to do this without using any synthetic implants, which is something that interests a lot of patients. So really the type of surgery you have depends on the specialist that you're seeing, and what the problem is, whether you've had prior surgeries before, and how big of a problem you have. So the severity of the prolapse also determines what type of surgery will be right for you. A lot of women are concerned about the use of pelvic mesh for pelvic floor reconstruction, and that is an appropriate concern because the FDA did put out warnings in 2008 and 2011 about the use of synthetic polypropylene mesh for vaginal floor reconstruction. That doesn't mean that using mesh in particular cases is a problem, nor does it mean that if you have had a repair done with pelvic floor synthetic mesh, that you will have a problem someday. So women who've already had a repair with this and are doing well, there's no reason to go in and take that out. So women who have pelvic mesh, it is not a product that is recalled that you have to go see your doctor to have this removed. Now, if you're in the small group of women who have had serious problems from the mesh, in those cases the mesh should be removed, and patients often require a reconstruction afterwards to support the tissues that were being supported by the mesh. Synthetic mesh can be inserted through a vaginal approach or through an abdominal approach depending on the surgery that is indicated, and that's the type of, you need to discuss the risks of mesh placement through the vagina or mesh placement through the abdomen with your doctor when they're counseling you on your surgery and whether you need mesh or don't need mesh. But not every woman needs mesh. And I would in fact say that if you have never had a prior pelvic surgery that has failed, so if you have never had your prolapse repaired before, it is very likely that your prolapse could be corrected without the need for using synthetic polypropylene mesh. Women who have had repeated failures of their prolapse, so they have their bladder lifted and the bladder comes down again, or they've had multiple operations to correct the prolapse, in those cases mesh can be considered because mesh is permanent and it can help in certain specific situations in the pelvic floor. But again, this is something that needs to be discussed with your surgeon or we're the specialist. And those of us who treat this particular problem are known as FPMRS specialists, so female pelvic medicine and reconstructive surgery. So who should you speak to about surgical options? Well, you might be seeing a urologist or gynecologist who has identified a problem of you having vaginal prolapse. And not every urologist and not every gynecologist feels comfortable surgically treating these problems. Those of us who have done special training in pelvic floor reconstructive surgery are specialists in that. Other terms for the specialty are female urology, urogynecology, or FPMRS, which is female pelvic medicine and reconstructive surgery. And there's a special board certification that is provided or earned through the American Board of Urology or American College of Obstetrics and Gynecology to become an FPMRS specialist. And so basically, as a specialist, we have special training in how to correct prolapse, but also how to correct prolapse in the recurrent setting. So in women who have already had a prolapse repair that failed, or maybe have had a complication of vaginal mesh, FPMRS specialists can help correct those and have special training to do that. So you can speak with your urologist, your doctor, or learn more at www.hmutx.com.